Hey everyone, this is Julie Lanford, the Cancer Dietitian, and I'm live here on the Build Up Dietitians Facebook page. I'm going to talk a little bit today about my experience working in oncology. We're going to talk about questions that people might have about nutrition for cancer patients, caregivers, survivors. So I'm happy to take questions. I think I can see them as they come in, but we'll see. We'll have to play it by ear and see how it works. But first of all, I want to show off my button, which might be backwards in your video. I haven't quite figured that out, but here's my Build Up Dietitians special button that I got at the Fancy meetup. So it says, nutrition, it's a science, not an opinion, which you know, when I became a dietitian, I wasn't really prepared exactly for some of the controversy I think that we all face in terms of nutrition opinions that are out there, and trying to stand up for your own expertise and knowing that you do have training and you know what you're talking about in the face of it feels like a lot of people who have very little training, strong opinions, and they want to argue about it. So I'll talk a little bit about that today, but I'm going to start just sharing what it's like to work in oncology. And I'm actually in a little bit of a non-traditional setting, but I did do an undergraduate degree in biology and then a little, I guess, an untraditional route to become a dietitian because I didn't have a dietetics undergrad. I needed to make up those classes. So I did that and did a master's in public health at UNC Chapel Hill with a built-in internship, which I really liked, to have that public health experience because it turned out that's my passion area is around public health. But as my first job, I worked in clinical dietetics. I did cholesterol, disease management, those types of things in I guess my first year of work. And then pretty soon after that, I worked over at an outpatient oncology clinic to help establish a program there. I was the only dietitian on that team, which actually has been my experience almost my entire career. I've not been in a department of dietitians. I've always been like the dietitian in a department of nurses or a multidisciplinary department, which works fine for me. And I like to be part of a varied group. But sometimes it is nice to be with dietitians. So I actually have found the oncology nutrition practice group to be a great space to find my people and for us to have support groups. And now there's so much to be done digitally that I have hosted some discussion groups online where other oncology dietitians will read a book or watch a documentary and then discuss it. And so that's how I've been able to find colleagues to share with, even though they're not my direct coworkers. Anyway, so that was a little off topic, but I did work in an outpatient cancer center, and that was for about 2 years. And while I was there, I worked with all types of people. I taught classes for survivors. I worked with patients, of course, during treatment and trying to address their issues. While I was doing that, I became good friends with a cancer survivor in another part of North Carolina where I live. And we talked a lot about what survivors are looking for when it comes to nutrition information. And he was coming from a place where he had been diagnosed with melanoma. It was a pretty serious diagnosis, but he had, you know, he was functioning well physically and he wanted to get in really great shape as much as he could despite his diagnosis. And so we spent a lot of time talking about some of the common questions that people have and how he was really focused on nutrition for recovery, which was a little different from what I spent most of my time with in a cancer center, was assisting patients sort of urgently with their crisis need, whether that's, you know, attending to poor appetite or unintentional weight loss, or the fact that they couldn't eat because they were so nauseated, or had, you know, treatment for head and neck where maybe they couldn't eat at all and they had to have tube feedings. And so I was addressing a lot of these urgent issues on the day-to-day basis. But then working with him and also other survivors that I was close with really helped me see a little bit of a bigger picture when it comes to nutrition for cancer survivors. And so with many of the questions that my clients would come in with, while they were coming in maybe for unintentional weight loss, they had so many questions because they were being bombarded by people trying to sell them a product, or somebody trying to tell them that there's a special diet they have to be in, or they can't eat this, or this causes cancer, or that's toxic, and they were very confused. Early in my career, which was about, let's see, I'm trying to think back when that was. So it had to be about 12 years ago. I got a lot of questions about, well, is meat bad for you? Should I be a vegan? Is dairy bad for you? Is sugar bad for you? And those are things that honestly are still very common questions today. And it feels even a little bit crazier today because we have this access to information that wasn't as prevalent before. But I didn't have a place to send them, is what I felt like. These crazy questions would come up. I didn't have time in our, 15 minutes that I could spend with them to address them all completely. And I was, wishing, well, why isn't there a place I can just send them to? And so working, talking with my survivor friend and really thinking through it, it was like I talked to somebody in my family who runs internet businesses, and they said, well, you can start a blog. And I was thinking, well, oh, okay, because I didn't even really read blogs. And but I really felt like I have things to say, to share with people. I want them to be able to read it. And so I started writing cancerdietitian.com. That was 11 years ago. Really just for the purposes of, here's the questions that I'm getting in my office. I want a place to send people to. And so I started collecting patient emails that wanted information, and then I would update them whenever I wrote something new. And they gave me great ideas for content too. So this was a combination sort of I did that on the side mostly in my free time just for fun. And then also working full-time outpatient cancer center, seeing people in radiation, seeing people in chemo, doing a lot of phone follow-up calls because I couldn't always catch them when they were in, or they had come for an appointment, their doctor referred them, they weren't coming back for a while, so I would talk to them on the phone. And then I also did teach some classes. So I did some cooking demonstrations there at the cancer center I worked at, and taught some healthy eating classes for survivors, and just really enjoyed doing those things. I also did some employee wellness. I felt like I wanted to spend more time on the survivor wellness and less time on the clinical piece of one-on-one nutrition support during cancer treatment. And so 10 years ago, there was a position that opened at a nonprofit here in Winston-Salem where I live. And I'm familiar with that nonprofit because I'd actually volunteered to teach classes for them before. So when the position came open, it was almost, the perfect fit for what I wanted to do, which was assist people with wellness. So that wasn't just nutrition. But I get to coordinate all of our survivorship programs here at Cancer Services, which is where I am currently in my office. And in addition to that, then we were able to bring the cancerdietitian.com website. So it's now, we term it our nutrition resource, bring it on as part of our programs here, which is awesome because I don't have to try to generate business out of it. I don't have to sell my soul and do sponsored posts or have advertisements that I don't believe in. When I first started the website, I actually had Google ads on it, and I could not control what types of ads got on there. So of course it was a whole lot of supplement ads or ads for things that I would never, suggest to a patient. And that was frustrating to me. So I quickly took those off and figured there's got to be a different business model for what I want to do. So I love that the nonprofit I work for supports the website. It has supported me in redesigning it when we needed an upgrade to the website. They support me through the email marketing. And then I'm also able to use the tools and skills that I've built through the blog to support some of our outreach and program promotion through Cancer Services. So now, as part of my job as wellness director, I coordinate not just our nutrition programs, but all of our survivorship programs and also our programs to address cancer disparities in Winston-Salem. So we have risk reduction, we do cooking programs and healthy eating programs, and I have lay health educators that go out in our community and do that. So to me, it's very fulfilling, and it's in a way where I feel like I'm meeting all types of people. So it's not just one demographic. It's not just people who can afford to pay for my services. I'm able to assist people no matter their income level if they come here to Cancer Services. And because of supportive Cancer Services, I can do these programs virtually, and to be able to reach people locally, but also, you know, across the world. So anyway, that's my experience as an oncology dietitian. Something else that I was going to talk about on this live is how to myth bust, how to calm. That's a lot of what I end up dealing with when it comes to helping my patients, is that they have been told something and it might be what we would consider a myth. Oftentimes myths have this like teeny tiny little piece of truth that's then blown out of proportion. So, you know, we call it a myth, but often there is a part of truth in it. So anyway, when it comes to myth busting, I try to be nice. That's what I say. I try not to step on too many people's toes. Because usually when someone is told a myth or told some information that maybe isn't completely accurate, they have been told by somebody they love or that they trust, or that is otherwise a relationship that they don't want to destroy. And I don't want to get in the way of that relationship. But I want the person to have the evidence-based information as we know it today, which isn't to say that things will change or won't change. So when it comes to myth busting, I very much focus on, first of all, what is the question that we're addressing? Because sometimes we can kind of go off on soapboxes or, you know, different directions. I try to keep my messaging really, really clear. So if we're saying that sugar feeds cancer is a myth, then what is the truth specifically around that? So my sort of truth around that statement is that all of our cells, cancerous or not, use glucose for energy. Glucose, that building block for carbohydrates. Our body does not pick and choose which cells get what fuel. So when I'm myth busting, I try to keep it very clear, short. I don't want it to be overwhelming with information because people glaze over, they get lost. I have found there are some people who seem to know a lot about their myth and they've really bought in. Most of my clients that come in and they say, well, you know, I was told sugar feeds cancer, so I can't have it. As soon as I explain a statement like that, they say, oh, well, okay, that's fine then. I can figure out a moderation or a balance. And I don't want to overwhelm them with so much information that they're glazed over and they don't understand. If I can bust the myth in 2 sentences, that's much better. So I always start with a short explanation, and then I let my client, or if it's a blog post, I let people write me back, or I let people comment on the blog post or on social media to ask more questions or to add more information that they need feedback on. Otherwise, you could just over-explain and waste your time and also give someone too much information. So that's kind of my approach to myth busting just in general. And then how to calm fears about food. I often tell people that rather than thinking about all the things that are bad for you when it comes to nutrition, I think that we should spin that conversation and rather think about what are the things that I need to include in my day to promote the health of my body. And by looking at it that way and focusing on the positive things that you need to take in, I think it takes the power away from fearing different foods. Of course, we need to educate around some of the foods. But the other thing is that if someone is truly kind of sold on one of maybe the myths or maybe some controversial topics, like let's say soy and breast cancer. I have a lot of patients who are told by their doctor that they should not eat soy, even though we have good evidence that soy in its whole form is perfectly healthy for cancer survivors, even hormone positive breast cancer survivors. But if somebody comes to me and they are very afraid of the soy, their doctor who saved their life told them, do not eat soy because it can cause your cancer to grow. You know, I might tell them the data right now shows that it's perfectly fine to eat soy in whole food amounts, but you do not have to eat soy. So I try to help people if they have a fear around something and I don't, you know, it's not something they absolutely have to eat, then I'm okay if they want to avoid it. There's lots of other ways that we can get plant proteins in. They don't have to eat soy foods. Something I think right now with the keto diet and people being very afraid of carbohydrates, that is something where, you know, avoiding all carbohydrates can cause harm, especially to people in treatment or people who are not able to get enough nourishment. And so that's a fine line to try to help people figure out. I did have a successful conversation with a client once who's, you know, the client was the husband, the wife was very much trying to stick to this very strict diet with very few carbohydrates, even very little amount of fat. She was avoiding, you know, all the conventionally grown anything. She was trying to do all organic. And he was, I mean, he was facing end of life, but he was also, I think, undernourished. And so we had to talk a little bit. So what I encourage them to do is to find out, you know, well, what are the healthy carbohydrates that we think we can include more in? Because his cells need that carbohydrate to function well and for him to have optimal quality of life. And so with that explanation, she was able to kind of take maybe the first step towards getting more carbohydrates. And that was, okay, well, let's step towards fruits, certain types of whole grains that she felt like fit her food philosophy. Certainly she was not going to do, you know, brownies for him. But being able to just get a little bit towards a healthier way of eating, I think I call that a win. I mean, I feel like that was one of my better moments, is to be able to free up someone's diet despite that fear. So the other thing that I wanted to do is to answer questions that anybody has. So I haven't seen anything pop up, and that might be from my viewer here, that I can't see them. So sorry if I miss it. I'll comment in the threads afterwards if something came up that I didn't actually see. But I know 3 questions have come in, and I'm going to cover at least 4. But they did come in through the Facebook event page. So the first one I'm going to talk about, someone asked about appetite stimulants for people in cancer treatment. So 2 things with appetite when it comes to cancer treatment. You know, there are medications that can help stimulate the appetite, but I think that before going to those, we want to figure out what is the problem, like what is causing the decrease in appetite. Is it because they're constipated? Is it because they have mouth taste changes? Is it because they have like gastroparesis, or like what is going on that's causing their appetite? Is it anxiety? Is it you know, something else that we can help address? The strategies from a dietary standpoint, of course, are small, frequent meals seems to always be the answer. Maximizing calories in the small amounts of foods that they are eating. Those are clearly things. When it comes to appetite and getting enough to eat, I have a little rule for my cancer patients. I tell them, I want, actually for everybody, but especially for somebody who needs to get those calories in every day, I want them to eat within an hour of getting up in the morning. So for people who are on medications where you have to take them with an empty stomach, and they typically take them first thing in the morning, to me, they need to wake up and immediately take that empty stomach medication and then wait an hour and then eat their breakfast. If they wait too long, or they try to find that window of 2 hours after, then sometimes that can mean that they go a long period of time without eating. So I like them to take that medication first thing as soon as they get up, then eat an hour later, and then eat every 2 to 3 hours across the day. And so if they do have to take naps to regenerate energy, then time those naps around when they've sort of scheduled meals and snacks. Of course, they can add healthy fats if they're concerned about the quality of fat and calories that they're getting into the foods they're eating. But really the frequency and having things on a regular basis, I think, is the most important. The second thing, so if those nutrition strategies aren't working, then we may turn to appetite stimulants. And usually that's something that the nursing staff, the physician can really help identify which one is most appropriate. And so I rely on that team to help figure out which one's going to work the best. All right, so the other question that was on there earlier was about alkaline and acidic diets or alkaline water, because some people will claim that cancer cannot grow in an alkaline environment. So this is what I would consider maybe as the number 2 myth around nutrition and cancer, is that somehow acidic diets cause cancer. The truth is there's no good evidence to prove that any dietary factors can actually manipulate whole body pH, or that has any influence on cancer or cancer risk. So that's the first thing to point out, is there's no data on it. The second thing to point out is that we are fairly certain that, you cannot change your whole body pH just by the foods that you eat. And then the other thing to explore is what is this thing about cancer growing in an acidic environment? So from what I can tell, and I'm not a total expert, but I have done a little bit of reading to try to figure out where is this coming from, where is this information coming from. The claim is that the environment around a tumor is more acidic than the natural body's pH. And so, but given that, that doesn't mean that the cancer is growing because of the acidic environment. From what I can tell, it seems like the cancer itself possibly is causing the environment around it to be acidic. And so that's not something we have any control over, much less the fact that changing what you eat doesn't necessarily change the body's pH. So for my clients, a lot of time that makes sense. The other thing to point out about alkaline water is that, your stomach acid is really, really strong, and pouring a slightly acidic or slightly alkaline water into very strong acid stomach is really not going to make much of a difference. So I think I even priced out the cost of alkaline water and what they claimed the pH was, and it's ridiculously expensive for the fact that you probably aren't making a drop of difference even in the pH of the liquid in your GI tract, much less the rest of your body. So usually my clients pretty much, they respond well to that. I've written on that as well on the website and I did a video around alkaline water. I think it's on my Facebook page and also on cancerdietitian.com. So you can see that. Sugar we talked about already. So sugar, alkaline is another big one. And then the fourth one I wanted to make sure that I addressed was the questions around organic, because I have a lot of my survivor clients who come in saying, well, I'm trying to eat all organic, because a lot of times they've read a book or they've seen a documentary or read something online. But most recently I've had someone come in who was reading a book written by another survivor. And this is where I find that people get a lot of their influence, is that it's another cancer survivor who maybe has been, following some kind of plan or been successful at getting themselves into remission, as if somebody has complete control over that. We know they don't have complete control, but when control is taken away, as in the context of cancer and even cancer treatment, you're told when to go in for your treatments. You're told this is your schedule, and things feel very out of control. And therefore, nutrition is a piece where, and exercise and some of those self-care things, they're where people can kind of grasp on and try to get their feet onto solid ground where everything else feels like it's shaking. And so they're reading books by other survivors who often are promoting a certain way of eating. And they tend to be very sort of perfectionist minded about their eating plans. And so one of those things that they talk a lot about is eating organic foods and limiting exposure to pesticides. And so what I tell my patients is that when it comes to organic versus conventionally grown produce or other foods, that there's no data at this point to show that people who consume organic foods have better health outcomes. So that's always my bottom line. We don't have any data on humans showing that if you eat organic, you have better health. So that's the first thing to know. The second thing I say is that what we do know promotes health, reduces cancer risk, and is the optimal way to eat for cancer survivors is to eat lots of plant foods. Whether they're organic plant foods or conventionally grown plant foods is not the biggest issue. The biggest issue is, are people actually eating fruits and vegetables? That's the biggest thing. And for a lot of surveys on cancer survivors, they're not necessarily eating any more fruits and vegetables than the general public. And so what I tell them is, this is a choose your own adventure. So if you have the resources and you can find organic versions of everything that you want to eat and you want to spend your money paying for it, that's fine with me. I am not opposed to that. However, for a lot of people, that's just not realistic. I mean, I told this one person who came to my office, she said, well, I'm going to eat all organic. And I'm like, I don't think that's actually possible. Nor do I think it's necessary. But for a lot of people, you know, if they see the organic version and the conventional version and they're about the same price, then they might lean towards, you know, buying the organic version. But I think for people to understand that the amount of pesticides that's used in conventionally grown produce is, first of all, regulated. Second of all, it's a very small amount. They cannot use it during certain periods of time around when produce is picked. And the third thing is, these are farmers who are trying to make a living. They're not going to, you know, spray over and over and over when they don't need to. And we are picky consumers and we don't want to eat apples with wormholes. So we've sort of created this like, well, I want a perfect apple and you better produce it exactly the way I want it done. And it's a challenge for farmers, but it's also just, I kind of feel like that's an unrealistic way to look at things. But you can certainly kind of make choices that work for you. And that's where I end up with my clients is, well, let's talk about this. What's important to you? What works with your budget? Where do you go shopping? What kinds of options do you have at those shopping places? And I want people to be able to eat their food without a lot of stress and anxiety. So my goals for my clients are really to reduce and lower anxiety around food. And so that means going to the grocery store, making decisions that aren't so confusing when they read all the labels, just figuring out what is it that I want to eat, buying it, preparing it, and enjoying it. And that's kind of where I hope that my influence as a dietitian will help. It's not about me pushing my soapbox on my clients. It's not about me, you know, giving my personal opinion about different nutrition topics. I really try to just lay out the facts and then help my clients to figure out, well, what's important to them, and then for them to make a confident choice for what they're going to feed themselves or their family member or whatever else it is. So that's about what I've got for today. I know I only covered a few things, but I've taken lots of your time. So you are welcome to add comments into the box, and I'll kind of keep an eye on it and add anything that I think that might be helpful for you. But I appreciate you joining me today, and I hope you have a great Friday. Bye.